Vaccine news live from local experts. Join KCAU-9's Tim Seaman and Sophie Erber now for Coronavirus Vaccination Information.
And good evening. Thanks again for being with us for this KCAU-9 Town Hall. It was almost a year ago that we had the first of these Town Hall sessions. Tonight marks our 9th.
That's right, officially. And over those many months, we wanted to know, of course, more about coronavirus and how it impacts Siouxlanders, and all of that has actually changed quite a bit. But our focus tonight is answering your questions all about the vaccinations and getting you the most up-to-date information.
And we want to introduce you to the folks that have taken time out of their evening to join us tonight and to bring you that information as we try to update you on questions that you may have and let these professionals who are, after all, right in the middle of this fight.
That's right. They are in the thick of this. And faces that if you watch us here on KCAU-9 News, I'm sure that you recognize. They're the ones informing us about everything from where to get the vaccines to how to sign up, because that has been a pretty big question.
Tyler Brock is closest to me, and he is the Deputy Director at Siouxland District Health. Tyler, we appreciate you being with us once again. Tyler's been with us on several of these occasions.
That's right. You'll see him here often. We also have Dr. David Enns. He specializes in family medicine at Mercy One. Thank you for joining us today. That is in South Sioux City, family medicine. And you've, of course, been involved in clinical trials as well for the coronavirus vaccination, something everyone's interested in because that's how we're getting so much statistical information. Thanks for joining us.
And also with us tonight is Liz Webb, a pharmacist at Drilling Pharmacy. And Liz, we appreciate your time tonight. Of course, Drilling Pharmacy is one of those retail locations that is now providing vaccinations to folks here in Siouxland, doing that good work.
That's right. And before we go any further, there's a reminder that we want to hear from you during this event. So please do let us know what questions you have about COVID-19, the vaccinations, or just the process. You could submit a question right now on our Facebook page. The address there is on your screen. That is facebook.com/KCAU9 News. We will try to have our experts answer as many questions as possible during this town hall event. You guys have your work cut out for you. Let's dive right into the numbers now. More than 768,000 people in the tri-state area are fully vaccinated. So that's some good news there. That includes 425,000 Iowans, 226,000 Nebraskans, and 117,000 South Dakotans. Now, those numbers do not include people who've only received one dose of the vaccine.
Tyler Brock probably has the best guess as you look at those numbers, if those are satisfactory or not. Lots of variables as we get started, but is that in the ballpark where we should be right now?
I would say it's pretty close to where we should be. I mean, all 3 states are operating with the amount of vaccine that they're given. And so given the amounts that we've had, I'd say that that's pretty good. We'd like it to be 100%
Sure.
by now, but that probably just wasn't a realistic factor. So everybody's doing the best they can with the amounts of vaccine they've got.
That's right. Now, a big question that we keep getting after getting vaccinated, so a lot of people have, as we just told you, do people need to still wear a mask? And if so, how long should they wait before even considering taking it off, going back to normal, so to speak? A big question we're getting. For any of you, really.
Doctor, we'll start with you on that one.
Yeah, CDC guidelines still say wear a mask after the vaccine. You know, you don't get the vaccine, next day you show up to work and say, hey, I'm mask free, obviously. They're starting to loosen some guidelines as far as if, you know, an entire family of high risk has been vaccinated, you can get into small groups and maybe take the masks off at that point. But for now, the public rules are still
And the science behind that, doctor, explain to our viewers too. We learned that the reason the CDC is saying keep the masks on, at least for now, is because it takes a couple weeks for the antibodies to build up. And so explain your body's reaction to the vaccine.
Right. So a lot of questions we'll get is, you know, gosh, I've heard that you get a fever or headache after the vaccine. Well, yeah, of course you can do that. That's your body's immune system ramping up. As far as the vaccines go, the Moderna and Pfizer, there are 2 series vaccine. We're really looking at 1 to 2 weeks after that second vaccine for your total antibody levels to be high and protective.
Thank you.
What about the longevity of that vaccine with the polio, mumps, measles, those kind of things? We're all, at least somebody my age, is used to getting booster shots as you get older. Are we going to be looking at boosters down the road, do you think, for COVID, or do we know yet, Liz?
We don't know that information yet. It's probably going to be a few months before we have that information to be able to provide.
I want to go back to masks just real quick. You're in a retail setting, of course, so you probably have the best view of people wearing masks or not, or asking, do I have to? What's your feel right now as far as the comfort level of mask wearing here in Siouxland?
I know at drilling we require it when people enter the store, and if they don't have a mask, we provide one to them. I would say across the board, when I go grocery shopping and things like that, I'm seeing a large majority of people wearing masks.
It seems like because they are required in some locations that it's become a bit more commonplace.
Right. Even in the places where it's not. You'll
exactly.
see people still do that on their own. We do want to take one of the poll questions. We've been asking our viewers. This one is, do you plan, if you haven't already, do you plan to get a COVID-19 vaccine? Now, 67% of people say they do plan on getting the shot. 33% of people still say no. So I'll open this up to you now, Tyler. Do you think that this number, we asked this way back a few months ago before the vaccine, the numbers have shifted a little, but do you think this is alarming?
You know, I'm not real surprised. A lot of the information that we had leading up to this vaccination program was that it was going to be, you know, 60% acceptance rate, things like that. So that was what we were hearing. There's been quite a bit of vaccine hesitancy, which is somewhat understandable, but it's a little bit of it's a new vaccine, and we can understand some hesitancy with that. But honestly, we've been seeing somewhere in the neighborhood of 60% almost throughout this whole thing. So the fact that it's 67%, you know, it seems like it's crept up a little bit. Yeah, I think people are becoming a little bit more comfortable. They're seeing more people get it, you know, and some of the negligible, you know, side effects to it. And I think acceptance rates are going up a little bit.
To the other two of our guests tonight, I'd ask that same thing, I guess. Are you seeing that tolerance of the perception of the vaccine improve as more people get it? I mean, so much of the discussion is actually, you know, socioeconomic. It is cultural, whether it's easily accepted or not. How would you judge that, Liz? Go ahead and start.
I've seen people coming to get COVID shots that haven't had flu shots in years. So I do feel like people are more eager to get the COVID shot than they have maybe been in years past. I also think as more people get vaccinated, that word of mouth starts to travel. And when they say that I tolerated it well, more people start to feel more comfortable getting the shot.
I'm guessing it's one thing for a professional to say it's okay, but when your cousin says I got it and it's okay, it probably helps.
Right, right. And one of the questions I get most often is they'll say, you know, doctor, I'm just a little leery. This was rolled out pretty quick. And I tell them, yeah, I agree with you. You know, it's, you know, we started the clinical trials here in Sioux City in, you know, beginning of June. So we're talking, what, 8 months. Normally it's 5 to 7 years for a vaccine to get rolled out. But, you know, this was obviously a completely strange situation and something needed to happen fast. But the good news is there is a lot of data behind the vaccine, a lot of good data.
Is there a chance that we'll see this? We probably won't see this exact thing happen, but because of the success in the short trials, could we see other types of you know, medications or things be moved along quicker?
Now that we see it's possible.
It's a guess, I know, but I'm just curious. I know that's a question I've heard.
And hope. I'm not sure what it'll look like moving forward.
Yeah, I mean, maybe with vaccines, and the only way I say that is because this, you know, messenger RNA technology, it's new, but it seems the way to go for vaccines. And, you know, one of the things they're doing now with the UK variant, and they say, oh gosh, you know, do we need to tweak the vaccine a little bit? It takes, you know, a week of research to say, okay, let's change a little technology here and we can get this out.
Very quickly for our viewers, you mentioned messenger RNA or mRNA. A lot of people are confused about what that means in a vaccine. People think they're getting live virus, but explain why that is not the case with the mRNA vaccines.
Yeah, the RNA just goes into your cell and it produces the protein that makes the spike protein. Your cell sees that RNA and it's gone. It degrades it.
Thank you. Yep. We do want to get to a Facebook question. You're writing us on Facebook right now. Submitted from one of you. It reads, why is it common for the second dose of Moderna to produce more severe symptoms if someone does get a side effect than that first dose? Is it a stronger dose or is it the same as the first one? And I'll open this up to all of you.
It's the same dose as the first one. After you have that first shot, your body's going to go ahead and start producing antibodies. So by the time you get the second shot, you're just going to have a stronger response because you already have those antibodies that exist in your body.
Makes sense.
Who shouldn't get a shot? We talk a lot about people getting shots. Is there anyone that should not get a shot?
Unless you have a history of having an anaphylactic reaction to a component of the vaccine, that would be the only person that probably should not get the vaccine. We're giving it to people who are immunocompromised because they're high risk, and so far, everybody's tolerating
There's a
it pretty
few
well.
people that maybe have had COVID a little bit more recently, and maybe they had some of the treatments, the antibody treatments and things like that for COVID. We'd like for those folks to wait, not so much because it's going to be harmful to you, but because the vaccine might not produce the immune response after you've had some of these treatments. So that happens. That's come up a few times over the last few months, but other than that.
And maybe, Tyler, you can address how these vaccines arrive at your clinic sites. I've had some people ask, can I choose my vaccine? There are 3 of them. Can I choose one? Obviously, you can't. Can you just enlighten us a little bit about how those vaccines?
Yeah, we've been starting to get a very consistent amount of vaccine now for probably the last month or so. But we do not get to choose. The state determines how much vaccine they're getting throughout the state, and then they allocate that based on population, based on other factors to the counties. So we do not control how much vaccine we get. And so what we're giving in clinics and what we're giving in other settings really is dependent on supply. Maybe we've got a lot of Pfizer and we need to get through that a little bit. Maybe our Moderna's built up a little bit more, and so we need to get through that. So we're really just trying to keep our supplies moving, and that's really the goal of this whole thing.
So speaking of that and supply chain logistics, the federal government has announced that as of, I believe it's March 29th, they are expected to ramp up even further, sending that out to the states. And so, at least in the state of Iowa, by April 5th, the general public can sign up. So this is kind of that moment that a lot of people have been waiting for. They no longer need the pre-existing conditions to qualify, or their job, age, things like that. So maybe talk about the logistics of that, because that sounds like a lot more work on both pharmacies' parts,
right.
Siouxland District Health, and also the hospitals just coordinating all of this.
I think we know already, for at least for drilling, we know how many patients we can take per day, especially if we can utilize the library and their space. I think we're looking forward to seeing more sites open up to get their hands on vaccine, because it's going to help to spread it out throughout the community, especially to other pharmacies in the area that are ready to take vaccine because they have patient lists that are already waiting to get it. That's going to take off a tremendous burden right now.
And we have felt for several weeks now that most likely at some point in April it would be available to everybody. Now that's still dependent on supply, so it just means that everybody's eligible. It doesn't necessarily mean that everybody gets their vaccine right this minute, but it does kind of take off some of the restrictions and some of the things that have kept people from getting signed up. But we do really feel like supplies are ramping up, and we feel like we've reached a point now where it's going to be available to everybody here real soon.
It was just earlier this week, in fact, that Governor Reynolds let that news out. Here's what she had to say.
Today I'm announcing that all Iowans will be eligible for vaccinations starting Monday, April 5th. Getting vaccinated is the most important thing that each of us can do to ensure that our state's recovery from COVID-19 is both strong and sustainable. We all want life to get back to normal, for our businesses to rebound, for our high school seniors to graduate together, our church communities to gather again fully in person, and our families to be reunited. All these things are possible, and soon. But like everything else over this past year, it will depend on all of us doing our part for the greater good. So please, let's pledge that you'll be vaccinated as soon as you can, and encourage your family members, friends, and coworkers to do the same. And we're all in this together, so let's finish strong together.
Tyler, when we talk about those that are eligible right now, might we see another vaccine? Are they still working on a 4th or a 5th vaccine, or are we where we're going to be, do you think?
I think there's others in the works, so I guess I won't be surprised if others come on the market. So we haven't heard. I don't know that there's anything imminent, but certainly wouldn't surprise me.
That would be good news. And go ahead.
Absolutely, yeah. I was going to say, speaking of, to your question, these vaccines, a lot of the questions we're getting is, who's paying for it? Because with pharmaceuticals, and I think all 3 of you can speak to this, there's a big price tag usually associated with any kind of drug. So who is paying for this? I'll start with you, Liz.
We bill an administration fee to patients' insurance company, and that's how we get reimbursed. If someone does not have insurance, we can bill through their Social Security number, and the government is covering that administration fee.
Thank you.
We know that you're sending us questions. We'll get to another one of those right in a minute, but first I want to turn to Dr. Enns, because not only are more people currently going to be eligible for it, but we're already seeing discussion about kids. And should young people be given the vaccine? When might they? What can you tell us? I know that you've been involved with that a little bit and have an eye on that.
Right. So pediatric trials are going on right now in the United States. We're currently in Sioux City, a backup site. We just, kind of alluding to what Tyler said earlier, there is a third company that just is kind of wrapping up, and they're waiting for the data for that to, hopefully be released. It's called Novavax. They're a vaccine company, and that'll be for adults. But yeah, the initial, pediatric data looks promising, especially in the older age group where they've studied first, maybe the 15-year-olds and above.
So teenagers looking at that.
Yeah, exactly.
We do have another, thank you, Doctor. We do have another question from our Facebook viewers. They wanted to know, when will the public know if vaccinations are needed annually? So we've kind of been alluding to this. We're not quite sure, but will this be maybe something that, like the meningitis vaccine, that all students might be required to get if they want to live in a dorm or even just to go to a public school? Do you guys think that this would be something annually or at least required?
Again, it's so new, we just don't know yet. I can tell you the 6-month data for these vaccines is very good. I think people are optimistic that the 1-year data is good. If you can get a year out of a vaccine, that might be something seasonal. That would be great.
Like the flu.
Yeah, exactly, but we just don't know yet.
You mentioned the flu. I had a doctor tell me the other day it's been the best year for flu ever.
That's right.
Is that true?
It has. Yeah.
People are being extra clean, and the social distancing, and I'm sure the mask wearing is helping all of that. We want to give you just a few numbers, too. We are learning that in Woodbury County, and of course, you've seen this effort at the Tyson Event Center play out, about 10,000 people have already been fully vaccinated. And maybe talk about the success of the logistics. The mass clinics have really been a sign of hope.
Yeah, it's really been an excellent experience for us, and I think our community as well. It has been fantastic how we get, Sioux Lane District Health Department gets a lot of credit for them, but I mean, we are really just one piece of that puzzle. An average clinic has probably 85 to 100 workers at that clinic, and the health department, if we have 10 people there, that's quite a few. So this obviously is a very large endeavor with a lot of folks. And that's been one of the things that just us as the health department being able to kind of help mobilize the community, whether it be doctors' offices, private pharmacies, hospitals, all kinds of folks have come together and made that a real success. And so we've been able to be very efficient with it. We did 1,800 people one day, and honestly, that wasn't even close to the max of what we could do. So we're going to stretch ourselves a little bit the next couple weeks with some of the things that we've got planned, see how many we can do. But it's been excellent for us, and we've gotten a lot of good comments and gotten a lot of people vaccinated, more importantly.
And Liz, as a pharmacist, you are involved in that on a much different scale. I know you've used the Morningside branch library to provide that location to provide the vaccines.
Right.
Comment on how your program has developed as well.
We are also kind of in the same situation. We are very fortunate to have volunteers and people that are really eager to be part of the solution. And I think we're fortunate, too, to be on the end of this where we're on the end providing hope to people, where they come in and they're just really thankful and excited to get their shot. And it's a different piece that we get to see. Yeah, we couldn't do what we're doing without people volunteering their time. Morningside, Sioux City Library, Morningside nursing students coming in to help. Countless people in the community are reaching out to see if they could be a check-in or observer, and we're just fortunate to have that.
We have gotten a few questions, and you've seen some national stories about this, I'm sure. And if you can't comment on it, that's fine, but I wanted to give you at least a chance to address it. Pregnant women are wondering, should they not? And I think only because, and correct me if I'm wrong, a lot of the clinical trials have not been necessarily tested on women who are currently pregnant. So maybe talk to our viewers at home who are wondering about that. Doctor, maybe.
I can mention a little bit.
We at the health department, we usually tell people to call their doctors. I guess.
Right. So let's call the doctor.
I tell them to call the health department. No, yeah, so in any clinical trial, the first question is going to be, are you pregnant? If you say yes, you can't, you're not going to be in it. But people, females did get pregnant during the trial, and it did. The limited data we have shows that it is safe, and the recommendation is to get the vaccine during pregnancy.
Okay, thank you. We've had
Let's get back to another question from one of our viewers that has had a question for us. Someone that has had both of their shots, obviously, is pretty much protected. What about them joining with someone else that has not had any shots?
I mean, the point of vaccination is to develop immunity against that infection. And if you are fully vaccinated, you have a low risk of getting the infection. You have a low risk of passing that infection on to other people. So in general, if our vaccine is, we have some confidence in this vaccine, you know, caution is of course wise, but we really do feel that, you know, vaccinated people should be able to interact relatively normally as they feel comfortable.
Thank you. There is, of course, always that question of, and we've seen this in national headlines again, that fourth surge that you know, people are talking about. Is there a risk of maybe someone who is fully vaccinated coming into contact with another strain or something and potentially passing that on, or is that not? It might be too soon to really know.
That's always a possibility.
Yeah.
I mean, no vaccine, I don't care what illness you're talking about, is perfect. There's always some chance that someone who's vaccinated could become infected. Our chances are a lot lower when you're vaccinated, though.
Variants is a word that we see tossed around in the media a lot these days, and obviously seems to be popping up more and more here in Iowa and in South Dakota. Do we know anything at this point, Dr. Enns, about these and how much the vaccine may need to be tweaked to help?
Right. Well, I probably can't speak to specific numbers,
Sure.
but we know that the Moderna and Pfizer vaccine do a pretty good job on these variants. And kind of like I said before, they can be tweaked a little bit if that time and point comes.
Is there a window on variants? I mean, after a certain amount of time, do viruses give up trying to change, or is this something that could continue to roll over?
Yeah, you know, anytime you have a vaccine, the virus is always going to try to get a little smarter for it. But I think it's going to come down to the number of people we can get vaccinated. I think April is going to be a big time period. You know, if we hit that 50–60%, then that virus activity goes down. And then whenever that happens, your variant's activity goes down too.
We're also talking a lot about here lately that graduation ceremonies, things that normally require large group gatherings, those are starting to come back on the board as soon as this May for those high school commencement ceremonies and for colleges. If any of you really want to talk about the safety in that, or maybe a warning for our viewers, because people might feel a little bit emboldened now that vaccines are going out and numbers seem to be going down regionally. Tyler, maybe.
Yeah, I mean, this is such a balance, right? I mean, we know, just as public health, we're concerned about infections, but we know that part of your health is also doing the things you enjoy and being with the people that you enjoy being with, and celebrating these important events are also part of our health too. So we just really want to have a balance. We want to be able to do these things. Again, I said earlier, some caution is probably wise, and maybe we can implement a few of these cautious things, but I think that we can reasonably do some of the things that we like to do. That's important for us as well.
Well said. Thank you, Tyler. We do have another viewer question. Let's
check in. We do have, as Sophie just mentioned there, does everyone get tested for COVID-19 variants? I don't know that you test for variants, do you? Is that, or you can...
I guess you could see if it's a different strain. That's how we're getting some of those numbers. But does someone just get a regular COVID test, or how does that really work?
Yeah, the regular COVID test just checks for the regular virus. I don't know if we're doing secondary labs. I haven't in my practice, at least in this area.
A lot of people now are also talking about self-testing. Our own sports director, Jake Jones, when he was covering the NAIA tournament, they really rely on people to do it correctly. So maybe, Liz, working at a pharmacy, do you see people testing themselves properly? Are they nervous about self-tests? Because now we're hearing things like airlines might soon require people to self-test. What's maybe a warning for people when a doctor or a health professional at least is not administering such an important test?
I have not, we don't do the testing at Drilling Pharmacy, so I haven't been a part of that, so I probably wouldn't be the best person to speak to that. Have you? I haven't done any of the testing piece of it.
We don't actually do the testing here, but we're starting to see more and more of this being done. And in general, these tests are pretty accurate. You know, you've got to make sure that you're doing it right, and I think there is some watching of how they're doing these tests. I know at the basketball tournament they do have folks that are being trained to actually make sure that it's being done correctly. You know, yeah, it's questionable. There's no question about it, but these tests are fairly accurate.
Thank you.
I want to ask a question, a personal question. So I had my first shot 2 days ago. I didn't feel much. I didn't know that I had a shot. I didn't know that I was even given the shot.
That's right, you said that.
But then my shoulder did get sore. So is there something you can do? Obviously the vaccine goes into the muscle, if I understand correctly. So what can you do to limit And it's not like I couldn't use my right arm today,
Right.
don't get
He
me
was
wrong.
just a little sore.
But can you do anything at all that helps avoid that?
You could do a cold compress at the injection site. You can also take Tylenol after you get the shot if you'd like.
And when might be, so Tim's reaction was obviously very minor.
They didn't let me off work, so.
Right. We still made him work here. But for someone who might, and it's rare, have some kind of a reaction, what might they look out for when it's time to call their doctor if something's really wrong? What are those symptoms?
Yeah, the biggest one would be if you, and this is rare, I think there's been like maybe 4 or 5 cases total reported, but if you have trouble breathing, you know, if you would get a widespread rash, commonly you'll see a little rash here, and shoulder pain like you mentioned, Tim, you know, move your shoulder work out a couple days behind, but otherwise it's pretty well tolerated from what we've seen.
We're in our last couple minutes here, so I just want to go around the horn and let each of you give one last battle cry, so to speak, to toe the line and get to the end of the tunnel here, because we talked in maybe the 3rd and the 4th that sometime there would be light at the end of the tunnel. That light's on right now, Tyler.
Yeah, I feel that there's optimism. I really do. I know there's still COVID out there, and we still have to be cautious with the things that we're doing and the precautions that we take, but I really do feel like there is some reason to be optimistic and start getting to do the things that we like to do.
Thank you. Liz?
Same thing. We're thankful to be able to give vaccines and hopeful that we're coming to an end with this pretty soon, and just, yeah, ready to see things.
Doctor, I know you're glad to help, but I'm sure you're ready for the phone to quit ringing and asking can I get a shot.
The same thing. I would never recommend a patient do what I wouldn't do. As soon as I could get that vaccine, I got it.
Yeah.
All right, thank you so much for joining us. We really appreciate your time. And again, if you join us here on KCAU 9 News, I'm sure you'll see these faces in the near future. We thank them for their expertise. And thank you for all of the questions that you've submitted to us. They've been very helpful.
As we say, toe the line for another month or so. Wear a mask if you can, and try to just be cognizant of those that you're around. It will make a difference as we continue to kick this to the curb, we'll just say that. And again, thanks for being with us tonight. We appreciate your participation tonight and through all 9 of these town hall sessions.
That's right, and if you'd like to watch it again, it will be on our website, SiouxlandProud.com. Thanks for watching. Have a great night.